Subject data science in healthcare. We'll be focusing today on this topic, governance in ethics for data science in healthcare, and end with study designs in data science for healthcare, which deals with retrospective analysis. So let us start this governance in ethics for data science in healthcare. So we are speaking about governance, we are speaking about ethics, and we are speaking about healthcare and data science combination. So the first term being referred here is IRB, Institutional Review Board. It's an ethics committee. What it does is it does research and it ensures ethical standards, it minimizes risks, protects participants' rights, especially in healthcare data. It studies the patient data, AI models, clinical trials to confirm compliance with principles like justice, beneficence, and respect for persons as outlined in frameworks such as Bellman Report. The example in healthcare data sciences, suppose you are developing a machine learning model to predict sepsis using electronic health records. So what IRB might be doing is it will be requiring de-identification of patient data, assessment of re-identification risks from big data analytics, safeguarding against biases that could disproportionately affect vulnerable populations like elderly patients. Next terminology is data minimization. Basically, it's a privacy principle. So give only necessary data. That's what it says. So that breach, risk of misuse can be avoided. So data minimization aligns with the data protection laws. Examples in healthcare data science are suppose we are building an analytics tool for diabetics management and we are using wearable devices for them. Now what data minimization here indicates that collect only glucose levels and activity metrics, exclude full genomic profiles to train the model. So with this what we are doing is we are lowering the privacy risk while maintaining predictive accuracy. HIPAA stands for Health Insurance Portability and Accountability Act, which takes care of protection of patient health information. GDPR, we all know, stands for General Data Protection Regulation, which is an EU framework. What it does is data subject rights, consents, accountability for processing personal data. What are the examples? Let us say you're studying COVID-19 outcomes. Okay. So what HIPAA does is it ensures that PHI is encrypted. What GDPR does is data processing agreements and rights like erasure for EU participants, preventing fines for non-compliance. Consent and reconsent. Suppose we are taking few participants for some study. So there will be taking their consent, their voluntary agreements. Reconsent is a dynamic consent, which is just updation or renewing of the consent as data uses evolve, such as in longitudinal studies, ensuring ongoing autonomy and addressing ethical shifts in data repurposing. The examples in healthcare data science can be, suppose you are using genomic sequencing study. Okay, so for cancer risk prediction, so you'll be taking initial consent, which covers sequencing, but you require reconsent. So when the model is repurposed for pharmacogenomics, we'll be informing the participant that there is a secondary thing, and you have the withdrawal option kind of thing. Model transparency in AI is achieved through explainable AI techniques like SHAP values. What it does is it builds trust, enables debugging, ensures accountability, especially critical in high stakes healthcare, where opaque black box models could lead to misdiagnosis. Example in healthcare data science, okay, you have radiology image analysis where you will be detecting tumors. So what transparency might do is feature attribution maps showing which image regions, e.g. lesions density, influence the diagnosis, allowing clinicians to validate output and audit for errors. What are equity audits? Equity audits in AI involve evaluation of the models for biases to avoid disparities, to maintain fairness across demographics, say race, gender, etc. So you may be using a metric like demographic parity. Okay. So basically, inequality is tackled here, and ethics comes into picture. Say, for example, you'll be doing some audit, and you have prediction models, and you see that underperformance for a minority group, maybe a race, maybe a gender. Okay, so there what you'll be doing is you may be using reweighting techniques to ensure equitable risk across ethnicities. So this was about the governance and ethics for data science in healthcare. Now coming to study designs in data science for healthcare. Uh, when we say cohort study, we are speaking about a group of individuals over time based on exposure status. For example, drug users versus non-users. Compare the incidence of outcome. Examples, you'll be tracking smokers versus non-smokers over 10 years to measure risk of lung cancer. Case control study indicate here, case indicate people with diseases. Control indicate healthy individuals. So it looks backwards to identify prior exposures. Example, a study of patient with myocardial infarction, heart attack, versus match control to evaluate prior NSAID usage. So what is NSAID? Is it there somewhere? Yeah. NSAID stands for non-steroidal anti-inflammatory drug. They are used for reducing the pain, inflammation, fever. Ibuprofen, aspirin are the examples. Next is target trial emulation. So what we are doing is we are designing observational analysis. What it does is it mimics a randomized control trial. So it defines eligibility, treatment assignment, follow-up and estimates. Say, example is you'll be using electronic health records to emulate a trial comparing early statin initiation versus delayed initiation in diabetic patients. Synthetic control. So it indicates intervention. Okay. It is constructed using weighted combination of multiple untreated units. Example can be evaluation of a hospital's new sepsis alert system by constructing a synthetic control using other hospitals without intervention. Registries indicate large structured clinical databases collecting observational data on specific disease populations or interventions. Examples can be SEER, Surveillance, Epidemiology and End Results Registry for cancer incidence and survival tracking in the USA. Pragmatic clinical trials, what they indicates is randomized trials conducted in routine clinical practice. Examples, comparing SMS reminders versus no reminders for diabetes medication adherence. So with this I'll stop.